Hello everyone, Dr. Touchan here. Today I want to talk to you about the effect of endometriosis on fertility because a lot of people hear the diagnosis and they don't understand why endometriosis is making conceiving very difficult. Endometriosis affects fertility in three main ways, and you don't have to have a severe disease for not be able to get pregnant. Number one, mechanical and anatomical issues. Endometriosis could cause scarring and adhesions that literally pull your reproductive organs out of its normal position. The fallopian tube can get kinked or stuck. The ovary can become fixed to the pelvic sidewall, or you could have an endometrioma that takes over the healthy ovarian tissue. When the anatomy is distorted like this, the egg and the sperm simply cannot meet the way they're supposed to. The ovary isn't free to release the egg, and the tube can't pick it up. Number two, of course, is inflammation. Endometriosis is not just a period problem, it's an inflammatory disease. Even if everything looks normal on ultrasound, on MRI, the pelvic environment is very inflammatory, filled of cytokine, oxidative stress, a lot of toxins that make this inflamed environment a place to damage eggs, reduce sperm motility, interfere with fertilization, and even lower embryo quality in vitro fertilization. So yes, even mild or invisible endometriosis can impact fertility because the chemistry around the reproductive organs is disrupted. Number three, the impact on the ovary and the ovarian reserve. Endometrioma and chronic inflammation can slowly destroy healthy ovarian tissue. This can lower your AMH, reduce the number of available eggs, and in some patients, accelerate decline in ovarian reserve. This is why expert surgery matters. Proper excision help, but poor surgery or repeated drainage can take away even more ovarian healthy tissue. Now, here's what I always tell my patient. Endometriosis does not mean you'll never get pregnant. Many women with endometriosis can conceive naturally after successful excision surgery. But for others, the disease creates obstacles that need to be treated, whether through an expert excision, fertility support, or a combination. The key is to get the right diagnosis, the right treatment early, because endometriosis is a progressive disease and preserving ovarian function matters. If you've been struggling to conceive and feel like something isn't right, your symptoms are real and you deserve real answers. So the question now, what symptoms should the patient look for if she's trying to conceive and could lead her to endometriosis? First, severe or out of proportion menstrual pain, pain with intercourse, chronic pelvic pain even outside the period, painful bowel movement, constipation around the period time, painful urination, urinary frequency worsens during the period, irregular or heavy periods, ultrasound or MRI that shows ovarian cysts that most likely endometriomas, family history of endometriosis, and again, even there is no symptoms, any unexplained fertility with full workup should lead you into endometriosis. You don't need to have all the symptoms, even one of these, especially severe period pain. Definitely endometriomas is enough to consider endometriosis as the cause of infertility. One of the most important questions I get, when should a patient with endometriosis seek fertility evaluation and treatment? I tell them, patient with endo should not follow the standard fertility timeline. The disease is progressing, damaging ovarian reserve, impacting conception earlier than general population. Don't wait if you can't conceive for 6 months with age less than 35. Seek fertility evaluation immediately if you're 35 or older. If you have an endometrioma, if you have severe symptoms, the rule is pain, infertility. Don't wait. And the best part, don't wait after surgery. Don't lose the window. After expert excision, this is the best time for pregnancy. Inflammation is reduced. Anatomy is restored. Ovarian reserve is at its best point. This is the highest likelihood of natural pregnancy. There is a 6 to 12 month optimal fertility window after effective excision surgery. Patient planning pregnancy should start conceiving as soon as they're cleared in the post-op period, or move quickly to IUI, IVF if necessary based on their age and reserve. And of course, that doesn't mean every patient after excision surgery should run and get pregnant. You should do what's right for you and your family. And if the reason for the surgery is pain and quality of life, of course, don't wait. But if the reason is pregnancy and conceiving, please do not wait. Go for the immediate 6 to 12 months after excision surgery to achieve a pregnancy. Another super important question I get, can treat pelvic floor dysfunction or pelvic inflammation like we do in PRM improve fertility outcome for endo patient? And the answer is absolutely yes. Treating pelvic floor dysfunction and pelvic inflammation can meaningfully improve fertility outcome in endometriosis patients, improve reproductive function, relaxing hypertonic muscles, improve pelvic blood flow and oxygenation, reduce pelvic congestion, improve intercourse, tolerance and frequency, restore normal pelvic organ mobility and uterine positioning, lower sympathetic overdrive, which can impair ovulation and implantation. Endometriosis create high inflammatory pelvic environment. What PRM treats, inflammation, nerve irritation, myofascial tightness, directly contributes to fertility by calming inflammation through pelvic floor rehab, neuromuscular retraining, ultrasound guided injection, anti inflammatory protocols. You help rebalance your pelvic microenvironment and support conception, both naturally or with assisted reproduction. It gives you pain relief, increased sexual function, improves chances of conception. It's synergetic with endometriosis excision surgery for a patient who had excision. By reducing inflammation, improved pelvic mobility, restored pelvic floor coordination, better blood flow to the ovaries, the uterus, less pain, more intercourse, improved implantation environment. PRM treatment protocol can significantly enhance the post-excision fertility window. So yes, treating pelvic floor dysfunction and pelvic inflammation absolutely improve fertility for endometriosis patients. It doesn't, of course, replace the expert excision surgery, but it's a powerful complementary treatment that boosts fertility outcome, and it's always recommended and encouraged. Finally, I want to say treatment at pelvic rehab medicine can support fertility through four major mechanisms: reducing inflammation, optimizing pelvic biomechanics, improving sexual function, and restoring a healthier reproductive environment. Endometriosis can make the journey to pregnancy feel overwhelming, but you're not alone. You're not out of options. The best outcomes happen when we approach fertility from both sides. Expert excision on one side to remove the disease, and pelvic rehab to calm inflammation, restore mobility, and support your body as it heals. Excision gives you the structural clarity. PRM protocol gives you the functional support. Together, they create the healthiest possible environment for conception. Solution is here, and we're here for you. You deserve care that listens to you, believes you, and treats the whole picture, not just the symptoms. And with the right team, your fertility journey becomes a path of healing, strength, and real possibility. I'm here for you. I want to help you in any way possible. Thank you very much for listening, and please contact me for any other questions.